I'd like to call to order the January 12th meeting of the Public Safety Committee for the City of Norwich. We do have a quorum present with all three members are present. And before we go any further, I'd just like to remind everyone that this virtual meeting is being recorded. So both, actually all, the audio, the video, and the chat are all being recorded. Okay. Before we move on in our agenda, I would like to just take a moment and have a moment of silence for Dan Auger, member of our Taftville Volunteer Fire Department, who passed away recently. And just out of respect for him and for the time that he served the city as a member of that department, just like to take a moment to reflect on his passing. And thank you. And on behalf of the committee, I'll just say our condolences go out to the fire department and also to his family. Thank you all very much. So our first item, the adoption of previous meeting minutes from December 8th. And I'll make one correction. It was actually December 8th, 2021, not 2020 on our agenda. So 12/8/2021. Is there a motion to adopt the minutes?
I can make that motion.
Is there a second?
I have one correction.
Yeah, we'll take that up as under discussion. That would be fine. So second to adopt.
Yes.
Okay, and corrections, additions, deletions. Alderwoman Gould.
Under fire department updates, under Yantic, third line from the bottom, where it says that Chief Ivers reported that on November 26th, Occam held an awards night. It should be Yantic held their awards night.
Okay, anything else?
It's the only one I have.
Okay, so to adopt as amended.
I'll make a motion that we adopt as amended.
Thank you very much.
I'll
Second.
second it.
Thank you. And by roll call, Alderwoman Berto?
Yes.
Thank you. Alderwoman Gould?
Yes.
And the chair votes yes, unanimously adopted. Thank you very much. Next item on our agenda is citizen comment. If you would like to be recognized by the chair, please unmute yourself and raise your hand. Oops, got a couple of people in the waiting room here. And please state your name and address before speaking. Is there anyone that would like to make a comment to the committee tonight?
Brian Koblars would like to do that. I reside at 16 Hobart Avenue. Go ahead.
Go ahead, Brian. You have the floor. Thank you.
Okay, thank you, Joe. In saying this, I do not mean to sound too official versus conversational, but a lot of detail within here, and it's only one of three subject areas that I normally would like to cover. Today, Hartford Healthcare announced they were opening 4 new test sites in Connecticut, which includes Bacchus Hospital in Norwich and Wyndham Hospital in Wyndham. Hartford Healthcare does have an infrastructure in place to schedule and process appointments, whether it be through the web or whatever system, it's in place. One concern I have is that we here as a city are identifying locations and providing those to the state of Connecticut without any advanced consideration of the logistics that will be required to make it work. will that responsibility fall onto the state, healthcare districts, local government, or individual venues? The cost for this effort, will it be new funding or a carve out from ARP funding? And safety, not only for those administering the tests, but for the individuals being tested. Being in a line of cars in an open air like Dodd Stadium versus an indoor environment are totally different testing environments. When you are in that outdoor venue, filling out the paperwork is completed while you're waiting for your turn in line. On the other hand, if an indoor venue, the line is just that, indoors. In that case, the number of people being tested needs to be regulated, which means appointments. What is the room load in that situation? Handicapped, ADA considerations need to be taken into account, and especially, does the HVAC system at each site keep everyone safe? Quoting from a report on Channel 8 today, Juliana Nolan, site lead at the Hospital of Central Connecticut, New Britain, stated they can test about 100 people a day, and they are set up for that. They have the infrastructure in place. There is also the issue of ensuring that all citizens have equal access. It was suggested that a goal was to bring testing to target populations that may not have automobiles and to perform those tests in an indoor environment. As some of you are aware, I was dismayed that all 3 locations recommended by city leadership were all within a half mile of each other, all in the downtown CCD. I have asked, what about Taffville? What about Ockham? Now, this is where I can pour fuel onto a fire, but I think it makes sense just as a suggestion for consideration. Our firehouses are distributed throughout the city. There are open air spaces where the trucks are normally parked. You have trained safety personnel, ventilation equipment, the ability to wash down when necessary. It's part of the physical infrastructure, at least, that is in place. What we're still missing is the logistics behind how to handle appointments, how to handle the testing and all of that. We have yet to know where that comes from. I think that should be part of the Friday morning teleconference and some reality brought to it. Like I said, 1 of 3 subject areas, but thank you very much for the consideration of speaking tonight.
You have 2 other things you would like to discuss?
Well, there were others. It was basically going through the stats for the state of Connecticut right now. If you look at the website today, we have a significant number of the population of Norwich that is being tested positive, cumulatively speaking, over 6,000 people. That's a good chunk of the population. We have 69 deaths that are registered in the city. Now, some of those, of course, may be coming from outside communities listed as Bacchus. The state doesn't do that type of breakout, but still it's a significant number. This leads me into really the third thing. At least several cities in the state are once again looking at the mask mandates. It's one thing to protect City Hall and city workers, but I think we should do a serious examination of when is a tripwire, if we haven't already reached it, when we once again require masks to be in public spaces, in businesses, etc. I think for the public safety, it's more than worth the consideration and discussion of how do we go forward from here. Thank you, Joe.
Okay, thank you, Brian. And moving on, I see that the mayor has his hand raised. Mr. Mayor, the floor is yours.
Thank you, Mr. Chairman. I just wanted to respond briefly and thank Brian for the issues he raised. I think they're all valid. I would add to that, though, while the firehouses have all the amenities he pointed out, some of them are actually located on main arteries where traffic is already congested, and that might in itself lead to people not getting access to a test site because they don't have ample parking to shelter cars off the main roads. The 3 that we submitted was based on the fact that Semaphore is ending their testing in the state of Connecticut at the end of this month, and whoever the company is chosen to replace them, it provided an opportunity for us to advance a request for additional testing. We have many residents who do not drive a car. They're somewhat isolated. While those 3 recommendations are within a certain distance of each other, they actually represent multiple areas of our city where we have an opportunity to reach out to people. The ITC, particularly because of the SEAT bus transit running through there, is an opportunity for us to coordinate with SEAT and set up transportation opportunities for people on bus routes to go there to the ITC. That's the reason that was included. The other 2 sites, they've actually held testing opportunities in the past. They have a good basis of people that have worked there in the past, and we're looking to tap those volunteer resources, if you will, as well. At the same time, we're hoping to, again, reach those people who have less means, less ability. Not everyone can get up to Dodd. It is extremely isolated. That's the reason for this request. We can certainly take under consideration his recommendation and take a look at the volunteer firehouses and even Central, if that were to be a viable site. So I want to thank him for raising those issues, but that's a little bit of the background. This was brought to our attention by Jennifer Granger at United Community Family Services on Friday morning. They had already begun a dialogue. So after the hour call, we had another call with some key people in the city at that time. It was brought to our attention that morning. We didn't have time to get notice out to others. So those who are already on the call, we asked them to stay on, and we'll continue to provide information to the general public as we get answers to our concerns. Thank you, Mr. Chairman.
Thank you, Mr. Mayor. Is there anyone else that would like to make comment to the committee tonight?
Joe,
Is
I
there
have
any-
my hand. Joe, I
There
have
we
my
go.
hand up.
Yeah, I was lowering the mayor's and I saw yours pop up.
That's okay.
Go
Good
right
evening.
ahead. The floor
No,
is yours, chief.
Yeah, just real brief to Mr. Kovalar's comments and to the mayor's comments. I think every fire department in the city is doing their best to keep COVID out of the firehouse. One of the problems that we may encounter if we open the firehouses up to the general public is an event which could literally wipe out the firehouse and the use of that firehouse. And yes, we always want to be part of the community, but this is also a time for us to be somewhat isolated.
Point well taken. Thank you. Is there anyone else that would like to make a comment to the committee tonight? Is there anyone else that would like to make a comment to the committee tonight? Third and final call. Is there anyone else that would like to make a comment to the committee tonight? Just double checking. I see no hands raised. Okay, so, citizen comment period is closed. Thank you all very much. Item number 4, ongoing business. Sub-item A, COVID-19 update. I had written when, according to Brian's comments, I had written test site selection, but the mayor essentially addressed the questions that I was going to ask of him and of the city manager. So we'll look at sub-item A, infection rates and trends on the local, regional, and statewide level. Mr. Salmon, what can you share with us to update us on our current situation?
Well, infection rates are increased drastically over the last month or so. And we now have infection rates that are exceed the infection rates of last January, February, when we had the largest surge of infections. The hospitalizations have gone up to about 110 in the New London County. That is approximately what the hospitalization rate was at its highest last year. If there's good news in this, is that the reliance on ICU utilization is less. So the anecdotal observations that this Omicron virus is not as serious is true to an extent, although if you are unvaccinated or partially vaccinated, there's a very large degree of infection that you could get from something very minor to something that approaches a fatal infection. So the bad news is the infections are rampant within the region. The good news is that although there's many hospitalizations, the infection severity is less. But when you have so many infections but lower averages, you're going to have more severe infections. So even though there may be less severe infections, just the sheer number that overwhelms the facilities makes it for a difficult time. So that's where we are. And the trend has gone up for about a month. Each week it's gone up to a certain extent over the time that we've had this. So that gets into the infection rate, Mr. Chairman. The next item, I think we talked about expanded testing sites and hours. There are some good news in that besides what was discussed. Dodge Stadium will have hours on Sunday now, which is very good. Before that, it was only during the week. So if you are employed and can't get there during the week, now you have a chance to get tested on a Sunday. So I think that's going to be very helpful. And it should reduce the load there. In addition, across the street from Dodge Stadium in the Hartford Healthcare Complex, they are opening up a kind of an annex testing site outside to take some of the load away. And that's very good news too. So we'll have actually 2 testing sites in one area to relieve the load. As was said by the mayor, we gave 3 tentative sites for Ms. Granger to bring back to the state as additional testing sites. We made the assumption that only one of the 3 would be selected. So they have some redundancy since we wanted to close in on a more of a central city site that has more access to individuals that don't have ready means of transportation. Either they take the bus or they walk. And these 3 sites do that. So that's where we are with the testing sites. Finally, home distribution kits. Since last we met, the city has had 2 distributions of kits from the state of Connecticut Supply, both around the same amount, about 2,700, 2,600 times 2, because there's 2 test kits in each. There's 2 tests in each kit, so it's a total of double that, 5,700, 5,400, depending on the amount. One of the locations was at Dodd Stadium. Dodd Stadium was great. It's easy to lay out the traffic. You could string out the traffic and not have the traffic spill out onto a main highway. And you can do 2 lanes and it works very well. Obviously, the bad part of it is that it's not accessible except by automobile. The next distribution we had was last week. We had it a little closer into town at Kelly School, and we distributed about the same amount of test kits that we had when we did the Foxwoods parking lot. Did I say with Dodge Stadium before? I meant Foxwoods parking lot if I said Dodge Stadium. So with that, we also handed out N95 masks. We handed out about 15,000 N95 masks. I do want to note that the N95 masks are adult masks, not children's masks, so they wouldn't be suitable for children. So with that, I can take any questions on the COVID update.
Alderwoman Berto, you have your hand raised. Go ahead.
Yes, I just have a quick question to piggyback off of what Brian said. Since the infection rates are so high, how come we don't have a mask mandate for the city? Besides the city government employees, how come with the surrounding towns putting some in, how come we haven't yet? Is there any plans on putting a mask mandate in effect?
This is basically the same decision that we made last time. Once we went off of a citywide mask mandate, we stayed off of that. We keep on asking the governor to do a regional or statewide masking effort. If you do a hodgepodge, it doesn't work, and it usually it confuses individuals. They go to Montville for something. There's no mask mandate. They come back into the city. There is a mask mandate. It provokes a lot of confusion. At this point, we are taking voluntary efforts, and we see pretty good compliance on it right now. So the reason is that unless it's done on a regional level, it's very ineffective and confusing, and actually angers citizens because they don't know where they should have the mask or not. Unfortunately, there's a lot of anger out there on this whole situation, and so we're relying on the interest in individuals. This is not to say that individual establishments can't utilize their own sequence for masks, and many have. They've required masks, like doctors' offices, pharmacies, certain restaurants. But we need a regional basis, even if it's only on the county. It would be helpful.
Thank you.
Okay. Alderwoman Gould.
I have no questions for the city manager.
Oh, I thought you had a hand raised or something. That's my mistake. Okay. And I don't have any questions on this topic. John, I appreciate the information. So moving on to item B, city manager's report on fire chief's meeting. So the city manager submitted the report for the December fire chief's meeting. It was presented at the council meeting. It will be in the council minutes. I also forwarded it, or made sure that it was forwarded or sent to the members of this committee. John, if there's no objection, I could just read this into the record right here.
That'd be fine.
Okay, city managers report to public safety for the month of January 2022. I met with the fire chiefs on December 14th. Due to a scheduling conflict, two of the chiefs are attending the 3-month-long state fire code class. The chiefs have not been able to meet on their own over the past month. We had a longer than usual meeting with many items discussed. One of my primary goals this meeting was to give the chiefs the opportunity to express any outstanding concerns or issues with the statewide radio project, as we are ready to make the commitment with the vendor to take advantage of some significant end-of-year financial incentives. The chiefs had questions regarding training and system capabilities, but otherwise they are all very supportive of updating the fire service radios and the CAD system. The chiefs discussed resurrecting a program for NFA students that gives an introduction to the fire service. The program ran for 6 years, but has not been done the past 2 years due to COVID. Chief Ibers is the lead on this program and will be soliciting the other departments for assistance in administering the 12-week program. The chiefs discussed the firefighting protective gear that each department uses and the possibility of using one vendor or brand of gear as a group. This may have potential savings in bulk orders, as well as provide a standard specification for gear across all groups. There currently are at least 3 different brands and specifications for gear used by the groups. They will work together to see what gear specifications they can coordinate on in the future. 2 of the chiefs asked where the city stood on the RFP for firefighter physicals. This has been a project involving the city purchasing agent and the chiefs over the past few months. Chief Montoya will check with Bob Castronova on the status of the RFP draft and report back to the chiefs. We discussed the recent city policy on COVID vaccinations and testing requirements. The volunteers were not initially included in this, but we did discuss whether they should be included in the future. On a COVID-related topic, it was brought up that a department encountered a patient on an EMS call that refused to be treated by non-vaccinated responders. This has not been widely encountered, but it warrants further discussion. The chiefs discussed recent calls of mutual aid. There were some concerns addressed on communications and acknowledgement to the incident command that the chiefs will follow up on. There was also discussion on utilizing one group over another and what is best for resource response. There are many factors involved and each call is different. The chiefs understand that the automatic aid is one of my priorities and needs to be implemented for the benefit of all. I spoke about the need for planning future apparatus purchases. I didn't go into depth. I just wanted to inform the chiefs that this will be on future agendas. My next scheduled meeting with the chiefs is January 11th. If able to, I will include notes from that meeting and an update for the January 12th public safety meeting. That meeting happened yesterday, but we don't have your notes yet. That's fine. John, if there's anything really pertinent from yesterday that you'd like to share, that's fine. If not, we can wait for your official report. You're muted.
We should wait till it's completed,
Okay.
Mr. Chairman.
Yep, not a problem. Thank you very much. Moving on then to item C, dispatch and radio system upgrades. I put this on the agenda because as you can see, it was a bulk of the conversation in the December Chiefs meeting. The council took action on funding this and helping to move this forward. I was hoping that a member of either the city manager or a member of the public safety complex could just give us the highlights of where the project stands right now.
Yes, either Chief Montoya or is Chief Daly here? He could also give a good explanation vis-a-vis the
John, I'm here if you want. I can just a quick update.
They're both.
Yeah, Chief, I think your department's taking some of the lead on this, so it'd be preferable for you to give the report if you're ready.
Yep. Since the action of the 21st, I believe, when we were able to get the document signed, is all signed and executed. The equipment's on order. Motorola is moving through their internal processes. No bugs or bumps yet. So on a 100-step process, we're probably step 12 or 13 into it, but the next steps are really in their hands. And there's been no report back of any problems. What they told us ahead of time was most of the equipment hardware that was ordered is and does not have to be constructed. It's already built. It's just a matter of shipping it and getting it here. Programming is going to be, it takes time because there's, I think, over 300 radios, and each radio has to actually physically get touched and programmed initially, and then it'll be programmed over the air after that. So it's moving, but not a lot of progress on this end because the work is being done now at the vendor side.
Okay, perfect. Thank you for that.
Alderman DeLucia, Chief Montoya here. The only thing I would add to that is today, Director Waters met with the CTS team as well as a Motorola rep, and they visited the EOC and the stations, one or two of the stations, to assess the need for consoles and consolettes, as they call them, actually.
Mhm.
So that was a good hands-on, eyes-on for the reps to see what the needs are. We had been communicating with the chiefs, all the chiefs, over the past week or so on what their station needs are in terms of the existing system. So we took that feedback, shared it with the reps to make sure that we're not going backwards. Everything will be maintained or improved upon. Some of the stations use the current consoles that we have for both speakers and in-house awareness, as well as some other applications potentially with sirens or traffic preempt on the lights in Yantic. So the CTS team and Motorola is aware of that. They looked at the systems. They made an assessment based on what they saw at the EOC and the stations that they did visit on what we'll need. So I think we're pretty good there, but I just want to add that. So there is still some site visits and still some interaction with them. It's been a great group to work with, and I'm happy to hear from Chief Daly that there is hardware already ordered. Thank you.
Thank you. That's all very good to know. So sub item 2, run card revision. I put this on here because I had a conversation with Chief Daly about the prospect and the benefit of refining our run cards and revising our run cards before we put them into the new system. So I thought that we could discuss the advantages and maybe the challenges with doing that as a group. Anybody have any thoughts on that?
Yeah, I'll chime in first. I'm sure the other chiefs have some comments as well. So we have talked about this in our meetings with the city manager as well as our meetings alone. And we also talked with it on one of our meetings when we had dispatch representative Captain Vega and Danny O'Brien there. A very brief summary of the status of the run cards is across the 6 departments, there are 3 kind of versions, PDF, two PDF versions and 1 Word version of the run cards that were submitted to dispatch. We all acknowledge that we should be on one standard form, so we're looking at that, which one we're going to use. But really the more important question right now, which has been asked of Lieutenant Perry to share with the Motorola rep, is what will be the best method to import run cards into the new CAD. So we don't want to go and reinvent the wheel to possibly have to reinvent it again. So we're waiting for that feedback from Motorola. Once we have an identifier of what the best method is for them, whether it's an Access or an Excel spreadsheet or a Word document or a PDF, then we can look at reformatting our current run cards to meet the most suitable needs to make a implementation into the new CAD. Pending any other comments or questions from me, I'll share that with the other chiefs to let them chime in. Thank you.
Well, just to touch on one thing that you said, one of the things that caught my attention is not only that, or do we have different file formats, but we also have a different layouts, right? As far as, we don't have standardization of the terminology, I guess, is the only way that the best way to say it.
No, understood, and we acknowledge that as a group, and we'll work on that.
Okay. All right. Anybody else from the fire complex that would like to add to that? Okay. Thank you very much. Oh, Chief Montoya.
Go ahead.
You popped up again as if you had something more to add.
Nope, I'm all set, sir.
Oh, okay. All right. Thank you. All right, then moving on to item 5, new business, department updates.
Joe,
Oh, I'm sorry.
I'm sorry.
Yeah.
I don't have a question, but I'd like to add one thing before we start with new business, if I could.
Absolutely.
Thank you. I would just like to offer my personal congratulations, and I will include the members of this committee in the congratulations to Scott Eggart, who has recently been elected chief of the Ockham Fire Department, and also to Chief Keith Milton, who has recently been reelected chief of the East Great Plain Volunteer Fire Department. So congratulations to both of those gentlemen.
Thank you for
Thank
that.
you.
Thank you.
Thank you.
Okay, so on to item 5A, new business department updates, starting with Norwich Public Utilities.
Good evening, Mr. Chairman, Alderwoman Good, Alderwoman Berto. We continue to monitor the developments with COVID-19 with our leadership team meeting daily. We are also working very closely with the city manager as well as local and state health officials to make sure we are taking all the precautions to keep our staff and customers safe. Currently, our staff vaccination rate is 85% and our PPE levels are sufficient. Unfortunately, with the rise in cases, we do have several members of our staff who are quarantining, but currently there is no impact to our operations. Moving on to other items, both reservoirs are at full pond, and we are continuing to work with NPD, emergency management, fire departments, and the city manager on the radio system upgrade. As Chief mentioned earlier, we did host a meeting today to discuss the EOC requirements. Additionally, we have also been supporting the police as they upgrade the control system for their emergency generator. We hope to have that the new control system installed in the next month. Pending your questions, that's all I have.
Questions from the members of the committee?
Nope.
Questions from any of the public safety complex for Eric? No, thank you very much, Eric. Moving on to, you're welcome. Moving on to American Ambulance. Good afternoon or evening, Rob.
Wherever we are, right?
Right.
Good evening, Joe, and members of the council. I'll start with a brief COVID-19 update and the impacts it's had on American Ambulance. Frankly, it's been quite the month for us, as it has for the rest of society. So over the course of the last week or so of December and into the first 2 weeks of January, we experienced a significant COVID-19 impact to our providers. At one point, we had up to 25 providers out quarantining, and we had a total of 30 who were either tested positive or affected by COVID-19. The other 5 didn't have any impact on our actual operations because thankfully they were scheduled to work for us during that period. Thankfully, all of them are recovering well, and most of them have already returned to work, and things are getting back to normal. But Omicron is here, and it is real. So in that vein, we have reinstituted a mandatory masking policy for all American Ambulance employees, regardless of whether they're in the building or out in the community. We are providing in-house rapid testing for all of our staff, whether they're symptomatic or exposed. And we have instituted a booster vaccine mandate across the board for all American Group employees, which will go into effect on 2/11 in accordance with the governor's executive order to extend the booster mandate to long-term care facility workers, which is how we were covered in the first place. For the month of December, our total call volume was 773 emergency responses in the city of Norwich. I had spoken briefly at the last meeting about how we were trending to, unfortunately, beat our numbers for November, and we did that quite significantly, even with the staffing impact. So things are we're definitely on the going up, and I can tell you from the first 11 days of January, we are on trend again to meet or exceed that number for emergency responses in the city once again. So I would implore the members of the committee and all the constituents to please take this seriously and take care of yourselves, because COVID-19 is here, but the rest of the seasonal flus and coughs and bronchitis and everything else is also taking an effect. So please just be cognizant of that as well. On an organizational level, we do have several new dispatchers that have come into the system and are currently training. I have had conversations with chiefs over the course of the last month about communications and procedures that we had discussed at a mutual meeting a month or so ago. And we've had a couple of hiccups, but we hopefully will be working through those and shouldn't have any significant impacts going forward. Just briefly for 2021, in the calendar year 2021, we responded to 8,936 emergency responses in the city of Norwich, which resulted in 6,263 transports, which is up from 2020. Unfortunately, I don't have those exact numbers here. I can tell you that despite the challenges of the last month or so, which was really our first significant COVID impact on our staffing levels, we are maintaining a 98.3% response compliance time still. So I'll continue to work with the fire chiefs regarding those significant concerns that they have to make sure that we're providing the appropriate level of service to the community. And as usual, we appreciate the opportunity to serve the city of Norwich as we have for the past 50 years. Pending any questions, I don't have anything else for you.
Questions from the members of the committee? No. Questions from the public safety complex in general? Nothing from us, Rob. Thank you for that report. Moving on to Norwich Police.
Good evening, Alderman and Alderwomen.
Hi, Pat.
The report, I apologize. First, after I hit send, I realized I had the wrong naming convention for the report, despite your very clear instruction on how to do it. So I'll correct that next month. December was a little bit slower of a month. COVID has hit us hard as well. We currently have 6 officers and 1 civilian employee out. One of the officers has long-term issues and has been dealing with complications for approximately a month and a half, almost 2 months. Staffing is a challenge due to retirements and lack of applicants. We've had discussions, I told you, the committee that before. We are still fully staffing our shifts, but it involves a significant overtime commitment and also mandatory overtime. We are working through that as best we can, trying to find solutions and working with the union to give the officers a little bit of respite. And early indications are at least they appreciate that. We also went back to a mandatory mask, N95 mask policy went in today. Our officers are to be moving forward being wearing N95 masks at all times. And also, we've also gone back to the original COVID policy from COVID's Surge 1, as far as our calls and having people come out of their houses and doing everything we can to limit contact. So that's where we stand for the first report for the end of the year, and we're looking forward to a better 2022.
Amen to that. Thank you. Alderwoman Berto, I see your hand up.
Yes, I just want to mention just to Chief Daly, congratulations on your new hire. How is she adjusting?
She's actually out tonight working nighttime car stops. So she's already jumping right into it. We're very
That's
proud to have
awesome.
Jordan, a Basra resident, which is now a police officer for us. She got sworn in yesterday. She'll be going to the academy in 2 weeks, so we'll use the 2 weeks time between now and then to start a lot of training to kind of get her ahead of the game. It's the kind of candidate we're looking for, college grad, or will be a college grad very soon, and with local ties and knows the community. So that's our prototypical candidate and the way she went through the background process. So we're glad to have her. And if again, if anybody knows anyone who's looking for a career and making a good police officer, please have them get a hold of me.
Yes, I
Thanks.
just sent 2 of them your way the other day. So,
Thank you. Send about another 10 more would be good.
well, you want the ones that'll show up to work first.
Yes, that is true.
But congratulations. I've been hearing good things. I'm so happy that she made it through and that she's enjoying herself.
Yep. Hopefully it'll be a very productive career for her.
Thank you. That was all I had.
All right, terrific. Alderwoman Gould? Okay. All right, and any other members of the public safety complex have any questions for the chief? Well, okay, thank you again, Pat. Emergency management update tonight will be given by Mark Waters, our safety and training officer from NFD. He was here.
Good evening.
There we are.
There we are.
Yeah, gotcha.
So my update for the month really is kind of summed up with one word: COVID. For the last 2 weeks, pretty much almost all my time has been spent on COVID. We've received 2 distributions of self-test kits and masks from the state at different times. The first distribution that we got was 65 cases of 45 self-test kits in each case. We distributed those to the public safety agencies, American Ambulance, all the fire departments, the police department, and we also distributed them to some of the schools, NFA and charter schools, some daycare centers, etc. And then the rest were done at a public distribution at the Foxwoods parking lot on January 3rd until we exhausted all of the supplies. A few days later, we got another distribution of masks and self-test kits. We've got another 29 cases of 90 self-test kits in each case, which is a little bit more per case. And we did along the same lines with that distribution, in that we distributed them to the elderly. I met with Chief Montoya and Tara from Human Services, and we kind of came up with a plan with the city manager to distribute them to the various elderly housing complexes in the city. We delivered a lot of them to the different facilities and individuals that needed them. And then we did the same thing with that, in that whatever we had left over, we scheduled another public distribution, which was on January 8th. We used the CERT team, and I thank the members of the CERT team and also Laurel Hill and Norwich Fire Departments for the individuals that helped out with that. The second distribution was in front of Kelly Middle School on the Saturday, and that distribution lasted about 2.5 hours until we were again out of supplies. We are expecting another distribution from the state We've had various contacts with the state, and we're kind of awaiting now as to finalize everything with that, and then certainly we'll communicate with everyone in the same parties to make sure that we have a coordinated effort to distribute any self-test kits we have. Personally, the fire department, emergency management, city manager's office, I'm sure many of you have also received calls from individuals that are, in various situations that they're not unable to get to a public event. I would say pass those names along to me. I made some personal deliveries to some people that were not able to go to any of the public events, and we'll do our best to take care of those individuals in the next round. We do still have N95 masks available, and as people are calling still for those, we're basically having them pick them up, either emergency management or the fire department. So other than that, as far as anything else with COVID, that's been consuming the majority of our time with emergency management. That's the end of my report.
Thank you, Mark. Any questions from the committee? Any questions from the complex? All right, thanks again, Mark. So we'll move on to Norwich Fire, Chief Montoya.
All right, good evening. First off, I'm going to add a couple comments to Director Waters' report on emergency management. First was he neglected, probably trying to block it out of his memory bank, that we had a initial scheduled distribution event and the state delivery fell through. So we had to scramble at the last second and cancel that. So I wanted to first acknowledge the agencies and Mark's effort in the short-term planning for that, and then the rapid turnaround on canceling and making notifications and dealing with all the phone calls, emails, and other queries as to why we did it, and getting all the feedback there. So that was my number one comment on him. The second one is our most recent distribution event at Kelly Middle School. I want to also share that, as we know, that was done after the snowstorm, and Public Works did a fantastic job of making sure that roads and areas were accessible for us. So kudos to them for that. And he referenced a third distribution, which I don't know if there'll be a third or a fourth, but there is a tentative one, probably 90% probability for this Friday, which is directed at the schools. So I just want to point out that it's for the schools, and that if you hear through the grapevine that we're hosting a distribution event, a POD is, if you will, a point of distribution for the state, that is school directed. The schools are in contact with the State Board of Ed and working that out. It's not a public distribution. It's not supplies for us to redistribute to the public. So I just want to try to kind of preempt any queries on that. So that's all I had for a few comments for emergency management. Again, big thanks to Mark for all his work over the past few weeks. On to the fire department. Response data was submitted the other day. Any questions on the reports that were submitted?
Nope.
None from me.
Okay.
Nope.
Moving on to successes or significant responses. On the 9th of December, the day after our last meeting, crews responded to a report of a structure fire at 147 Franklin Street. Upon arrival, they found a fire presenting from 2 bays of a 4-bay commercial garage with extension to the roof. Quick attack and interior search. The building was thankfully vacant at the time. The employees had left about 30 minutes before the fire was reported. Fire was placed under control in approximately 40 minutes. We had assistance on scene from East Great Plain, Laurel Hill, and Mohegan Tribal. And we had coverage for the city provided by Yannick and Taffel. And I believe, maybe Chief Ivers can do this in his report, I believe Yannick took in an interesting MVA call while they were providing coverage there. Public Utilities and Police Department also assisted on scene. Fire is under investigation by the Fire Marshal's office, and there were no civilian nor firefighter injuries reported. On 11 December, 2 days later, 74 Orchard Street, a single-family home. Units responded to a report of a structure fire. Upon arrival, crews reported heavy fire from the front and side of a detached garage with extension to the exterior of the primary residence. All occupants had safely evacuated prior to fire department arrival. And with occupants confirmed safe, the crews could just make an initial attack on the fire and knock it down quickly. Fire is reported under control in about 10 minutes. Damage to the siding and windows of the primary residence, but no extension into the house. The garage and contents were a total loss. That fire as well is under investigation by the fire marshal's office, and assisting on scene, again, was public utilities and the police department. Volunteer groups provided coverage for the city while the city units were operating there. Again, thankfully, no civilian nor firefighter injuries reported. On 29 December, 78 Prospect Street, two-family home, units responded to report of a kitchen fire. Upon arrival, crews reported heavy fire showing from the first floor rear of the building with exterior extension to the second floor and eaves of the building. Crews assisted an elderly resident from evacuating from the second floor, while other crews stretched the line and made initial attack on the fire. Mohegan Tribe and all Norwich volunteers assisted on scene and provided city coverage. Again, public utilities and the building department on scene providing assistance. That fire was placed under control in 1 hour, and again, currently under investigation by the fire marshal's office. Red Cross did assist with 7 displaced persons from that occupancy. One civilian was transported to the hospital for evaluation of possible smoke inhalation. No firefighter injuries reported. On 8 January, 213 Main Street, mixed use occupancy. For any panel members that aren't familiar, mixed use is in the fire service what we would call a building that has both commercial and residential units in the same building. 213 Main Street, as you know, are primarily commercial businesses on the first floor, and some of them have apartments above. In this particular address, it's commercial, a convenience store on the first floor, and on the second floor is apartment, third floor is vacant. So crews responded to a report of a possible structure fire. On arrival, found heavy smoke showing from the first floor of the commercial occupancy, and as well as smoke from the eaves. So again, another interior attack, aggressive interior attack made. Support, I don't have a full report in front of me, so I'm going to guess that there was some mutual aid involved there as well. I happened to be at reserves over the weekend, so I did not make that fire. So if one of the other chiefs want to comment on mutual aid, if they were there, or if Director Waters does, I'll let them add that afterwards. So let's go to last night, 11 January, 195 Corning Road, a barn fire. Not the kind of trend that we like, as I just reported, all our significant fires. So units responded last night to a report of a barn fire. Well en route, both us and mutual aid companies could see this fire from quite a distance. Upon arrival, crews confirmed a working fire in a barn approximately 100 by 300 feet. They immediately requested tanker support, knowing that we have water issues in that area, and requested a second alarm mutual aid assignment. Once water was established, we went to a defensive operation with master streams and hand lines. Mutual aid was provided on scene by Taffville, East Great Plain, Laurel Hill, Preston, and Mohegan Tribal. Public Utilities, Police Department, Public Works, the Building Department, and the Red Cross Canteen also assisted on scene. Family members were able to remove most of the animals from the barn, but one calf did perish in the fire. With the extreme temperatures last night, it was single digits. The water supply limitations, it's just it's a bad area for water because of the water system. It's just they're not highly rated hydrants in terms of volume. It's a loop system, so if you take from one hydrant, you might have another hydrant down the road, but you're just robbing from yourself. So a tanker shuttle was established. That was, let me see if I can get this all right. Taffville, EGP, Preston, and Laurel Hill responsible for that. And as I talked to Chief Jenks and Chief Westervelt last night at the back of the command vehicle, it was an educational session for me on tanker operations and that whole inner workings. I've been fortunate over my career, as most areas in the city are well hydranted with a good water supply, that I haven't really dealt with it in the past. And last night, especially with the temperatures and the volume of fire we had, the tanker group was critical to us. Kudos to them for that effort. That fire was placed last night under control in about 2.5 hours. We ended up using, I think, a little over 2,800 feet of 5-inch hose. And if you've ever picked up 5-inch hose in 5-degree temperatures, you realize that you have about 3 to 5 minutes to pick it up before it freezes once it's drained. So again, challenging environment, challenging conditions, and excellent work by all. All groups work together to help each other and get our stuff off the ground and packed away so we could leave there without having to use ice chisels to get our equipment back. No reported injuries on civilian or the fire side. Like I said, 1 animal did perish. Critical needs, as always, Squad A, and I'll just leave it at that. For staffing, the new hires, the new firefighters that were hired, they will begin their orientation with the city on the 24th of this month. They'll have a week-long orientation and start the recruit program at the Fire Academy on the 1st of February. There was a little concern for a short while about the ability to get both candidates into the recruit program because of statewide demand for the program, but we were fortunate enough to get both of our candidates in. Battalion Chief Wusik's retirement was effective last week, officially effective last week. So a promotional exam announcements for battalion chief and captain will be in the coming weeks, with the idea of a springtime promotion across the rank board as everyone moves up, and getting that done before the recruit program graduates in the spring. So well before, hopefully. Facilities wise, both stations still remain closed to the public. I will Mr. Kovalar's comments earlier about utilizing the firehouses, I will echo Chief Ibers's comments that, we're close to the public to protect our members. On a daily basis, we're responding to COVID calls. We have a high enough exposure as it is, and with a critical role and the staffing what it is, we want to minimize that as best we could. And also, as the mayor noted in his comments to Mr. Kovalar's question, was that the traffic flow of either of the stations in the city into our headquarters would be problematic should we have a backup. So, well, I would love to be in a position to offer a testing site. I think there are certainly more viable testing sites across the city. Let's see what else I had for you. For COVID, unfortunately, as Rob from American pointed out, the community, we're not immune from it. We've had 9 positive cases over the past 3 weeks. Of those 9, 4 of them are breakthrough cases in vaccinated personnel, and 5 of them are in unvaccinated personnel. 2 are back to work already. 1 scheduled to return to work tomorrow. I have not received any reports of any significant medical complications due to the COVID, but I will keep you posted if I do. PPE supplies are plentiful. Chief Daly mentioned that they went to an N95 mandate, which I think is excellent. If there are any departments that need PPE, please reach out to Mark or myself. For operations and in the street activities, the nature of the business is there are times when you can't protect yourself, but they are doing the best to minimizing crew contact, wearing proper PPE, and doing everything they can. It's just, as we know, it's so prevalent that it's just a matter of time, unfortunately. For the fire services, as the city manager mentioned in his report, the chiefs did meet with the city manager on Tuesday of this week, yesterday. Seems like so long ago with everything that's going on. With COVID and other commitments, we did have a hybrid meeting with 5 persons participating via phone and 3 persons in the conference room on the conference call. It actually worked out kind of well. I think for the most part, my personal preference is in person. I think you just have better communication that way. But this particular meeting went well the way we handled it. Our next scheduled meeting is for 15 February, and we are hoping to meet with Rob from American prior to that. And as I mentioned earlier today, Director Waters met with the CTS group and Motorola reps. So pending any questions, let me make sure I'm not missing anything. I think that's all I have. Pending any questions. Thank you.
Well, thank you, Chief. And I would just like to take a moment to thank Chief Wusick, congratulate him on his retirement, thank him for his service to the city, and wish him the best of luck in his newest professional endeavor. But we all owe him a huge debt of gratitude for stepping up the way he did while you were deployed, Chief. I can't say enough for how much I personally appreciate how he saw that he was needed, and he filled that need, and he did it even though it didn't always put a smile on his face. And I will always hold the deep admiration and appreciation for what he's done, not just then, but just as a member of the fire service in his city.
Agreed, sir.
I see Alderwoman Gould. I see you have your hand up. Go right ahead.
Thank you. Chief Montoya, for the fire at 213 Main Street, was there any impact from the new roundabout to hamper firefighting there?
Ooh, that's a good question. Mark Waters, or any other chiefs that may have been there, do you have any input on that?
Chief, I don't think that can you hear me?
Yes.
Yep, we got you.
Okay. From what I saw, I don't think there was any impact from the roundabout to the fire. The ladder truck would be the biggest concern in that, and truck one was able to get a very good position in the front of the building. Squad A was the first new engine, and they were able to get the hydrant okay and everything. So I don't think that the roundabout really hampered any kind of firefighting efforts for that fire.
Excellent, thank you.
Alderwoman Verdo?
No, thanks.
No. Anything from the rest of the public safety complex? Okay, moving on. Thank you. Oh,
sir,
I'm sorry. Yes,
if I
go
may
right ahead.
add a comment, just because Alderman Gould's question reminded me of something. Last month, the question was asked about Squad A expenses for maintenance and stuff. So I forwarded that information. Just want to make sure everyone got that okay. But more importantly, well, equally importantly, I should say, Director Waters' comments on the roundabout and minimal impact made me think of something else downtown, that every time I drive through town after an evening meeting at City Hall or something, it's in my mind, but I always forget to mention it. So I'm glad I'm remembering now. I don't know when it happened. I'm going to guess that it took place while I was deployed. But there is a series of lighting that crisscrosses across the downtown streets. And I don't know that any consultation was done with the fire department when those lights were put up. But they're fairly substantial. Obviously, they span a great distance, and they support electrical wiring. So it's just not something that we're going to push out of the way. Plus, it's live electrical, so we're not just going to push it out of the way. But it does have a consideration in terms of aerial placement and operations. So I don't know. I'm not looking for an answer right now because it's kind of off topic. But I'll follow up to see, when exactly that came about, what discussion or input was had from the fire department, and what options we have on including fire department input on future projects that may have implications on operations to us. Thank you, sir.
Thank you, Chief. That's an excellent point. Okay, moving on to Taffel.
Good evening, everybody. I hope everybody's warm.
Hi, Chief.
I submitted, thank you for your moment of silence for Danny Auger. He's definitely going to be missed. In the last 50 years, he's probably been at every major incident in the city of Norwich. So He's to give 50 years of service to your community for free, or even with a salary is basically unheard of in today's day and age. Anyway, so I submitted the paperwork for the reports. Sorry I was a little late. The fire last night and work today kept us a little busy. Significant events. Obviously, we had the fire last night. Back in December, we had a third alarm fire at 150 Norwich Ave, which actually wasn't as bad as we originally intended or could have been. Aggressive attack by the crews were able to get in and stop the fire as it spread through the pipe chase and didn't make it to the roof. You had several mutual aid companies there, Norwich Truck 1, Engine 2, Occam, and an engine from Yannick. We were able to hold it, and the Red Cross is assisting them families at the time. Building department was there, and due to the damage, the building's been obviously condemned until they can get it up to snuff. New Year's morning, we had a fire on New Year's morning that came in as a structure fire. It ended up being a debris fire outside that's under investigation. We put that out in about 5 minutes with a little bit of help from the Occam Fire Department. Critical needs. We are working our way through an issue with the roof on the building that was unbeknownst to us. We found it when we went up to hang Christmas lights. It's one of the things. It's a flat roof. You don't go up there very often. We've been working with the finance department to come up with a remedy for that and maybe a different viable option. Parking lot is still an issue, as Mr. Kovalar says, and just to reiterate what the other chief said, we just don't have the parking capability for our own members, much less the general public in itself. Plus, being so close to the school, I think it would cause other problems. I know we run into problems when school dismissal is going on, or they have the food pantry across the street. COVID-19, last month it was reported that our numbers were extremely low as far as vaccination. We did some deeper checking and tracked down a few people, and we're actually up to about 93%. In the last month, I've had 4 people out with it. I do have 2 that are quarantining right now, but it has had no impact to our operation. In the month of December, we continued on with our public educational, public relations events, public service events. We participated in Wreaths Across America with the local VFW and the American Legion, as well as several other events. Other than that, if you've got no other questions, that's all I got. Members?
No, I'm sorry. I'm asking the members of the committee if they have questions for you, Chief. No? Well, I don't have anything. Thank you, Chief. Moving on to Yannick.
All right. Good evening, everyone. Yannick responded to 72 calls last month. That was a pretty significant increase from the last couple of months. One of the things I found interesting in the stats were 25% of our calls were overlapping. So a total of 18 calls were going on simultaneously while we were out at other runs, and they were all, everything was taken care of. We also completed our training with Norwich Public Utilities. As I had mentioned earlier, I kind of wanted to wait till the colder weather to do that. Again, good program by utilities, so I appreciate the effort that they put into it. We had 2 trainings, one in the morning for our daytime crew, one in the evening for the evening crew. And because their peak shaving plant with the LNG is up in the industrial park, we did a hands-on site visit of the LNG tank, the piping, and their odorization system. So again, good training for all of us. On the, again, mid to late December, and on the December, I believe, towards the end of the month, reinstituted the 100% mask policy, trucks, patient intervention, and within the station. And some of our public events were canceled or postponed. The one thing I did want to mention related to COVID, and I probably should have brought it up early on in the meeting. In the minutes, it had us down at around 51% vaccinated. That number's again in the mid to high 70s, up around 78%. So if we could just adjust that. A lot of the calls we went to were, I'm going to call them maintenance related. And I'm not sure if because it was a relatively warm November, but we had a lot of calls, couple CO calls, but a lot of calls where the heaters were putting out a smell, the furnaces weren't operating properly. So multiple calls related to home or business maintenance and related to their furnaces. Fault calls still appears to be a bit of a concern or an issue. That's at 12.5%. And met with the purchasing agent yesterday to look for a spec for the Plimo vent system, which is a priority. And as we have talked about, Joe, as other capital improvement projects include, we're receiving quotes for the air conditioning for the first floor, and we're receiving quotes. Excuse me, I take that back. The survey has been completed. We haven't met with the gentleman yet, but the survey is completed for the parking lot alterations. We also, jumping back COVID related, we also had post-Christmas 4 firefighters that were out of service due to an exposure. 3 were breakthrough, 1 was an unvaccinated member, and all those folks are back in service as well. I'm sending 1 firefighter to Eastern Connecticut Fire School for a Firefighter 1 program. That starts for him, I believe, at the last weekend of the month. I've reached out to NFA regarding the introduction to the fire service program. COVID seems to be confusing things a little bit. If anything, I'd like to do maybe a modified program, maybe just 1 session. Take that back. 1 session per organization, and again, just give them that taste of the opportunities available to them in the fire service, both on the volunteer side and the career side. And if the bug bites, maybe a bunch of us will get new members. We took advantage of the passing out of the COVID test kits, as well as the N95 masks. And on a working with the public note, we conducted a food drive just prior to Christmas at Stop and Shop. So I wanted to thank Stop and Shop. They haven't allowed that stuff to happen. And about a half the food bank we work with is through Sacred Heart Church. They were down to skin and bones in their cupboards, and they now have about a 13-month supply of food, as well as $700 in cash and gift cards.
Wow, that's great.
Yeah,
That's
yeah.
fantastic.
Yeah.
And as far as the motor vehicle accident that Chief Montoya was talking about the night that we were covering headquarters, those folks went for a ride someplace down, I believe, on Shipping Street. They got on the railroad tracks and called for an accident up by Burnham Square, came in, and the guys looked down, and they are down on the tracks. So they got down in the old Shetucket Iron and Metal, and they did some surprisingly significant injuries for the quite bumpy ride from Shetucket Iron and Metal up to the Burnham Square area. So, but again, working together, the coverage allowed us to take care of that while the city was at their fire.
All right, terrific. Anything from the members?
Nope.
Okay, thank you, Chief.
All right, thank you.
Moving on to Occam. Chief Eggert, I just saw you on the screen. There you are. Oh,
I'm here.
Oh, there you are.
All right. Yeah, good evening. So obviously run stuff was emailed out to the Public Safety Council.
We got it.
All right. So last month we responded to 26 calls for service, bringing our total for the year to 236, 43 of those being mutual aid. That's an increase of 37% in our calls from 2020, and that's the most that we've ran since 2015. So obviously a huge success for us on that one. With that, the second half of the year, we did increase our call volume. It went from 87 in the first 6 months to 149 in the last 6. Last month, we responded mutual aid to Taffville for a structure fire on December 11th, and then stood by at Engine 2 for the structure fire in the city on the 29th. And then, as Timmy already mentioned, we did go on New Year's Day for the structure fire in Taffville there. Critical needs. So engine 41, the parts that we've been waiting on for months now have finally come in. We just needed to go down to City Garage to actually get the rest of the electrical upgraded. So that's a major success for us. ET 42, we've had no issues with that in the last month. And then Squad 4 has been out of service since the 3rd to get body work done since parts finally came in for that. And it has been out since. Hopefully we'll get it back on Friday, but not positive because we were supposed to have it back this past Friday. So we'll see if that happens. Membership holding steady. We're doing well. We've got some good recruiting initiatives moving into the next year. So hopefully we'll bump those numbers up. Other than that, I've got one member that's finishing up firefighter 1 at the fire school. She's got to take her written. She passed her practicals on last weekend before. And then I have 5 pending for EMT, so that'll bring our numbers up for that. In terms of the facilities, so we are continuing to work on the grant, which needs to be done by the end of June, from what I'm hearing. And the new sign, they were supposed to break ground last week, but they haven't due to weather and cold and everything else. But the frame is all done. They're ready to move it at any moment, so that'll start going in soon. The replacement of the doors will start in February, and coinciding with that install, they will also do the keyless entry install to go with that. Also in February, we got the new gear washer coming in, and then the dryer's not coming in until June. Other than that, we're working on the quotes to finish up the rest of the grant. So as always, anytime you want to come down and see where the grant money is going and where the upgrades are, you're more than welcome to come and visit. We'll take you for a walkthrough and show you what's going on. Training wise, so I have one member that needs to do their practical and written exams for NREMT, another one that did his practicals but needs to, or no, passed his written, I'm sorry, and then has to take his practicals for NREMT. And then I have 2 more that just need to take other portions of it. I don't have anybody scheduled to take courses in the spring just because of the fact of personal schedules and COVID and work not allowing them to take time off. So we'll modify that and hopefully send them in the fall. And then I am looking into career cert, which some of the other departments are using to help us kind of get some of the CMEs that people need in the meantime as well. COVID wise, we do remain open. We're following the CDC guidance on everything for that. PPE is required on all calls. We did institute a 100% mask mandate again in the station over the last couple of weeks. We had one member test positive a couple of weeks ago, but has since returned, and no other issues with any of our members testing positive or having symptoms. And we do have 30 out of our 34 members that are vaccinated. So that puts us at 88%. Other than that, we continue working with the other chiefs on the radio and dispatch upgrades like we've already talked about. And then any of the other topics that are of concern. Last Tuesday, we did sit and meet with the SOG committee to start that off. So they're working on them. I know for my rep, Les, he's already got most of his stuff done. So he's turning that in and getting ready for next month's meeting. And other than that, as Alderwoman Gould already mentioned, I did take over as chief on the 1st, and I did want to acknowledge and thank Chief Spalding for his years of service as chief and his continued service as the deputy chief moving forward. His guidance and mentorship over the years that I've been a member there has been tremendous, and obviously couldn't have made it this far without what he's done for the department. And with that being said, over the next couple months, if I'm unable to attend or take care of the meetings, my Captain Lawton will take over and probably sit in on these meetings. So that way Carol can focus on some of the other stuff that's going on. So pending any other questions that you have, that's all I got.
Well, I'll just start off by saying that I echo your comments about Carol. Chief Spalding's, just a class act across the board, a dedicated public servant. And you could not do better in terms of having a mentor. And the fact that he's sticking around to help you find your way as the leader of that department just speaks volumes about the man and the person that he is. So my highest hope that he stays healthy. And again, my personal thanks, and on behalf of the committee, our thanks for her service.
Thank you.
Any questions from the members? Nothing. Okay, moving on. Thank you very much, Scott.
Thank you.
Chief Milton, EGP.
Good evening, everybody. Well, we'll get started. Last month, the EGP responded to 84 calls for service. We ended the year with a total of 956 calls of service for 2021, which I think that increased off the top of my head. It was like 41 or 42 calls from the year prior. Continuing our monthly trainings and our online trainings, had one member completed and passed Firefighter 2. Apparatus, Service 5, which is our fire police truck for traffic control, had numerous repairs done. Engine 52, front tires were replaced, two front tires. Rescue 5 replaced the alternators that burnt up on a scene. As a matter of fact, came back from one of the city structure fires, and it burnt up on us, and so that was replaced. I was out of service for approximately 5 days. I also had an antifreeze leak that was repaired as well. Our COVID PPE supplies are good, as most departments have already mentioned. We've had several members test positive for the virus, and some were had some exposure, so they've all isolated and everything. But everyone's back. The ones that actually did test positive for the virus were fully vaccinated. EGP is about 93% completely vaccinated of its members. As again, sounds like the broken record here. We've also instituted our mandatory mask wearing in the station, and it's always been on the calls ever since. That's never really gone anywhere. We were supposed to have the firehouse resited this past fall. That didn't happen because of supplies being short, so I'm hoping that's going to happen now in the springtime. We had 3 new awnings that were built by some members, and those were installed. That would need to be done before we actually resited the firehouse. My critical needs for the firehouse, engine 52 replacement, and the parking lot of the firehouse also needs to be replaced. Other than that, that's all I have. If anyone has any questions, I'll be more than happy to answer.
So if you may, I don't know if you overlooked it or if you saw it, and I didn't see your response. And was Service 5 the truck that I was asking the question about? Did you see that email?
Yes. Yep, I did. I did reply back to you.
So I apologize. Then I missed your reply. Yeah.
No, that's okay.
Yeah.
So the old service truck was a donated truck from SNET years and years ago from one of our members who worked there.
Wow.
When all the new apparatus came in, we took over Taffel's old squad truck and converted that into our new Service 5. And our old Service 5 truck was donated up to the Eastern Connecticut Fire School for them to use around the grounds up there to move equipment to and from.
Yeah. Okay. All right. Thank you very much.
You're very welcome.
Because I knew we talked about it, and then I couldn't, because I didn't write down what we talked about, and then I didn't see your reply. It's my fault.
That's okay. Don't worry about it. No problem.
All right. Thank you. Anything from the members? Okay. Thank you, Chief. And moving on, Laurel Hill. Pete Clark, is that you on?
That is me. Good evening, Aldermen and Alderwomen. How are you doing today?
Good. Very well. How are you?
Very well.
Doing good. So
Good.
Happy New Year. Chief Westervelt's unable to attend tonight. I first wanted to thank the residents of Norwich to help donate to the St. Vincent de Paul Soup Kitchen that we had at our boot drive in December. We were able to raise $2,300.
Wow.
Give or take a couple of dollars. I don't have the exact amount, but I believe 2,300 was the exact one. Chief Westervelt delivered to our local soup kitchen already. It was great to see the support from the local community. That was awesome. We also had our annual Santa Run, which many residents were extremely thankful for us running the event. The kids couldn't have been happier to see Santa Claus on top of hose tender. They were ecstatic. COVID-19 supplies are sufficient. We do have a mask mandate in our department as well as all our trucks, just like all the other departments. 95% of our members are vaccinated. We did have a breakthrough case and actually 2 breakthrough cases that already had the members return from service. We had 1 member going to EMT class starting this month. We have 1 member that just finished Fire 1, just has to pass the written. He already passed the practicals. We have 1 member going into Fire 2 this month. So that's also good. And pending any questions, that's all I have right now.
I don't have anything from the members.
No.
Oh, we're good. Deputy Chief Clark, good job.
Thank you.
Thank you. With permission of the committee members, there has been a member of the community that joined the meeting late and raised their hand but joined after our citizen comment. I'd like to give the person the opportunity to speak to us if there's no objection.
Nope.
I have no objection.
I have no objection.
Thank you very much. So caller with the last 4 digits, 9000. You've been waiting very patiently. I hope you're still there and I appreciate your patience. What would you like to say to the committee tonight?
Sorry, I didn't even realize my hand was. Hi, this is Beryl Fishbone, 19 Bliss Place. I didn't even realize my hand was still up. Thank you for recognizing it.
You're more than welcome. Thank you for waiting.
Going back to the handouts of the masks and the tests. A better way has to be found to communicate the times with the public. The time in the newspaper said that the handout on Saturday in front of Kelly was going to be at noon. And it started at 10, which meant that the people who arrived at noon were too late. They had already run out of masks and tests.
Mm-hmm.
Something's got to be done. A new website or putting it onto the website that people can see would help tremendously. Putting it on Facebook is not working. Not everybody reads Facebook faithfully. They don't keep it up. Obviously, the newspaper must have gotten it wrong, although the New London Day had it starting at 3 o'clock. So while everybody had packed up and left by noon, you had people arriving, and then finally they got discouraged because there was no sign left saying, sorry, we're out of masks and kits, or it ended or something. Then you had people arriving at 3 o'clock and not seeing anything at all.
Right. Yep. There were a number of factors there. I see that the mayor has raised his hand. Mr. Mayor, I think I know what you're going to say, but go right ahead.
Thank you, Mr. Chairman. I appreciate Beryl's concern. In both cases, Foxwoods and Kelly, the traffic authority, in this case, Captain Vega, had to make a judgment call. Citizens arrived so early and pre-stacked the lines in both distributions that it became a management issue for those volunteering, as well as a traffic safety issue throughout the city. In the case of Foxwoods, they were lined up for 3 o'clock at 11 o'clock, and there were 2 lines out the entire parking lot perimeter spilling under Route 2, which is why they made the judgment call in order to move those cars forward. It's an imperfect world that we live in, particularly with this COVID, and everyone's trying to do the best they can. But we have to also keep in mind that there are other issues that coincide when traffic management and safety itself for the volunteers comes into play. And that's why they started early. It wasn't planned that way, but the public is showing up so early to these, it's creating hazards in the neighborhoods. And in this case, on the east side on Route 2 is State Highway itself. It's a judgment call at that time, but our police department does in fact manage traffic authority here in the city. I don't want to tell people not to show up in order to get in line, but enhanced communication will help as we go forward. But those are the issues. That's why it happened. And it wasn't that it wasn't intended to start on time as published. It's just that the sites were overwhelmed by the need. Thank you, sir.
Thank you. And thank you for your comments, Beryl. Anything else for the committee?
Nope, I'm good. Thank you.
All right, thank you. You have a good night.
You too.
Thanks. Okay, and with that, I will just say that our next meeting is going to be February 9th, 2022. The agenda says via Zoom. That's the tentative plan. Obviously, if we have a sharp decrease and our meeting format can change, that'll happen in consultation with the city manager. We'll go back to in person, but let's plan on Zoom, and if we can change it, we will.
Okay.
And having said that, I'll entertain a motion to adjourn.
Motion to adjourn.
Made and seconded by Alderwoman Berto. Thank you. All right, and by roll call, Alderwoman Berto.
Yes.
Alderwoman Gould.
Yes.
The chair votes yes. We are adjourned. It is 8:37 p.m. Thank you all very much for your time and your patience. This was kind of a long one. Be safe out there and have a good month.
Thank you. You too.
Thank you. You
very
too.
much.
Thank you all.